Most guys walk into EMDR and they have no idea what they're getting into. You've been told EMDR works, it's the best trauma therapy, and yet you have no idea what happens in the session, what it's supposed to feel like, and most importantly, how do you know if it's working? Those are some of the core things we're going to cover today, so let's clear it up. I'm Dr. Greg Donahue. I'm a licensed therapist in the state of Texas and in California, but I own and operate the Couch Psychology Center. It's a men's specialty, trauma, sexual addiction, infidelity, identity issues, men's focus therapy clinic in Texas. Anywhere, if you happen to live in Texas and you need extra support, look us up. We'll find a therapist that fits what you're looking for. But today we're talking about EMDR. I probably use EMDR with a third of my clients, which means I have done hundreds of hours of EMDR sessions, and I have experienced my own personal EMDR therapy. It's made the biggest shifts for me in my personal trauma, which is why it holds a special place in my heart. So to start us out, what is EMDR therapy? EMDR stands for eye movement, desensitization, and reprocessing. A lot of complicated words, but I'm going to break it down and how it was broken down for me. Let's start with the desensitization part. In most of trauma work, we are needing to activate our nervous system and then allow our nervous system to be desensitized to a specific trigger. The most basic example of this is phobias. Think of a fear of heights. You expose yourself to a certain height that is charging, but still tolerable. So you sit there, you observe the height, you experience it, your nervous system spikes up. Over time, your nervous system will be reassured. I'm still safe. I'm experiencing this. Your nervous system will actually downshift. And from that moment, you will start associating even boredom and safety with the thing that used to terrify you at that level. You increase the level, so on and so forth. Exposure to spiders, exposure to whatever you want, whatever terrifies you. That's the science behind desensitization, is pushing your nervous system to get used to something till eventually it kind of becomes bored with it. So before you go jump too far into how EMDR does this, does it expose you to the therapy? Yes, but not as intensely as you would think. One of the best parts of this practice is that you don't need to relive the trauma therapy in order for it to be successful. We're going to go more into that later, but I wanted to say it up front. Outside of desensitization, you have the eye movement part. It seems like a strange thing to add into a therapy style, but it has to do with the tactic that is used in EMDR therapy called bilateral stimulation. Bilateral stimulation is a complicated way to basically say your brain is being activated across the meridian. Now, eye movement was the first study they did because it simulated rapid eye movement sleep, REM sleep. In REM sleep, we process memories in a very unique way. It basically, at night, opens up the filing cabinets of our brain, and we get to process memories, traumas, emotions in a really unique and effective way. EMDR uses the technique of REM sleep, and it opens it up to be a little bit more intentional. But we're still using the opening the filing cabinet of memories through using eye movement similar to REM sleep. Now it can be done, we found out since, that it can be done in lots of bilateral stimulation ways, such as tapping either side of the arm. A lot of walking and swimming techniques can do the similar kinds of thing. My favorite is also audio, but in earbuds, a lot of people, we have these vibrating buzzers in each hand. As long as it stimulates the body across the median left, right, you're good to go. So that primary tactic, as it simulates REM sleep, is primarily for reprocessing memories. The reason it's important to go into the memory system and refile it is because traumatic memories are stored very raw in a moment of vulnerability. Most trauma is because we were surprised by something, or we had to endure something, we felt powerless or hopeless to it, or even that we were alone in processing our emotions from that moment, whatever we experienced, onward. Either way, our experience at that time is locked in as a raw, primal experience. And unless we go back and revisit it, it gets locked in that state of fight or flight. So let's dive into the nuts and bolts of EMDR and how does it work. So you're walking up to a session, the therapist is trained in EMDR, you're most likely going to face these various phases. The first three phases of EMDR are focused on preparation. That's going to be getting some history taken on the issue that you want to work with. They're looking for memories that are the heavy hitters, because memories, they're called core emotional memories. That's really the bread and butter of EMDR, and I'll explain that in a second. But the therapist is basically going to want to look for What are the strongest memories, the earliest memories, and the more recent memories related to whatever issue you're bringing up? So that's considered history taking. Then there's a preparation phase related to, do you feel like you have the coping skills related to dealing with the memories that might come up? Because obviously you can only cover so much in a session. So they want to make sure that you have tools that as soon as you get out of a session and you go home, if you're still feeling opened up and raw, you have things that you can use. The most two common exercises that they will have you do is a safe place exercise. That is a mental exercise where you picture a place and a time period in your life, or just something you imagine, where you are just blissful. You're on your own. It's just you. You feel centered. You feel safe. And going through all the five senses of that, what do you see? What do you smell? Really painting a picture around it. And if you practice that, you can actually train yourself to revisit that place in your mind as a reminder of your nervous system to downshift again. So safe place is a really cool and effective method mentally. The other option they use is a container exercise where you will design, and it's actually pretty cool how many different containers I have heard designed by this point, and everybody comes up with something slightly different. I've been surprised. The container exercise where you imagine a container to hold the memories and experiences as we work through it of that particular issue. The idea is that you imagine yourself opening that container, putting all that stuff in temporarily, closing the lid, because we have to get back to our day-to-day lives. So those are both mental techniques. Personally, I will also use things like Wim Hof breathing, square breathing. I love somatic and body techniques, ice plunging. There's so many different ways to calm the body that are physical in nature, going for a walk, grounding with just bare feet on the ground. Those kinds of things are my favorite because they're fast acting and they're very predictable. So once you have those preparations in mind, the last thing to prep is the target that's going to be chosen. So the therapist will help you identify the core emotional memory that's going to be what they call the train station. The train station is where you start an EMDR session. Before the bilateral stimulation begins in the session, you will bring up in your mind the image and you'll set up a belief. Usually a belief is like, I am weak, or I am powerless, or I should have known better. There's going to be some sort of belief tied to a memory that's captured in the history taking process. And that's going to be the train station for EMDR sessions until it's resolved. The idea is that you've picked a memory that activates the nervous system, both physically and mentally, in the way so that when you actually start the REM sleep bilateral stimulation, your brain is going to reprocess that particular memory and you'll start to feel a difference, and that your nervous system won't respond to that theme of memories. And the cool part is when you pick a core emotional memory, it tends to domino effect all other memories and other generalized things related to that emotional issue. And bilateral stimulation is kind of a therapist sitting there, either using a technique, virtually speaking. We have a program where it goes back and forth, or the audio. And we're just sitting back watching for basically body language and emotional experiences. It happens mostly in silence, where you're inside just experiencing mentally from that memory where your brain goes. You're kind of a passenger from the train station onward. You check in. What happened? Therapists take notes. If there's a block or you're looping around a concept, the therapist may intervene. But for the most part, if your brain is going, we let it go. Your brain knows where to go better than the therapist does. It's why this is one of my favorite methods, because the person is healing themselves at a very effective rate in ways that I wouldn't often know how to do it. Once the preparation is set for the first target to be addressed in EMDR, then the magic begins. Phase 4 through pretty much onward is going to involve the bilateral stimulation, and that's what we would call the work of EMDR gets done. The actual sessions begin, because it flows very different. Most therapy will have the natural talking back and forth, but in traditionally trained EMDR, that's not the way it works. It's a lot of that silence with for about 36 sets. I mean, the standard is about 36 back and forth, but I usually end up running somewhere between a minute to a minute and a half of just sitting and processing. Think of it almost like triggering a deep meditative state, because that's oftentimes what the bilateral stimulation will do, is it'll trigger the brain to start processing deeper and faster than it normally would, like deep meditation. So the therapist is going to be watching for that. So once those sessions begin, Let's go on to what does it feel like? What do you go through? So let's talk about the early experiences of EMDR. There are 3 general ways that I see men progress in this. There are other ways, but these are the 3 really common ones. One is the skeptical guy. This is a part of us that doesn't believe that stuff like this works, or we're skeptical, or especially when we're just sitting and it feels awkward and we're new to it, everything in our brain is like, this isn't working. This is dumb. I made that up. That's not trauma work. Our brain will just have this blanket trash talking of the entire experience. I'm a freaking therapist, and I absolutely did that. The other way that this can go is, instead of skepticism for the process, it could also be skepticism for ourselves. Like, I'm doing it wrong. I'm not getting what I should. I don't want to say that because they're going to be embarrassed of me. We will second guess ourselves. So that kind of skepticism and worry is insanely common. So that's one way it probably will go for you when you experience. Your mind will just go through this questioning of the entire process before it can relax into the process, which a good therapist will just kind of sit and be patient, because we know that's a part of the process. And honestly, to respect a brain for being self-protective. The second way that this can go is with memories. And it's a fairly common one for, once you bring up that core emotional memory, your brain will often dive back into it and kind of just remember the nuances. Depending on how strong it is, that can be kind of intense, but the bilateral stimulation does make it a little easier. And you'll be amazed at how quickly your brain will revisit a memory and kind of be surprised at how scared we were of the memory. It's almost like, wow, this is what I was so afraid of, but I now can see this nuance. This person was going through this. We start to view it from an outside looking on kind of lens. And so going through the memories is often where people's brains will go. And one of my favorites is when the brain will skip through other similar memories. So if the target is social anxiety, your brain will just kind of jump to all the different social anxiety memories. And that is exactly by design. Sometimes the brain will go thoroughly through different categories or sections of life. Other times it'll go to rapid fire. Now, this is the cool part where I see a lot of guys that say, I don't remember a ton of my childhood. And suddenly this domino effect starts happening where they remember more than they thought they would once their brain starts going down that road. So this is where a lot of cool things come up that me as a therapist, I can't predict. And it's why I love it. Now, obviously, we're looking for dysregulation, and a therapist is going to help you from escalating too far. One of my favorite methods is just to, if someone is getting wildly flooded with emotion or something unexpected came up, I will have them check back in with the room, use their 5 senses, say, all right, start feeling your hands, take a breath, stretch, and I will start asking them math questions or data point questions. When we use our logical brain, we can pull ourselves out of an emotional experience. So don't worry, a good therapist will help you to stay grounded and centered, even if really aggressive memories come up. So the first method was skepticism or even feeling like you're doing it wrong. The second way it comes up is to start just seeing and processing memories. So the third way that this shows up in EMDR therapy is you might experience your brain going into metaphors, which is going to be imagery or almost like a dream, with things that you don't necessarily know how to explain. As soon as you tap into an emotion, especially if the trauma was young, like 4 and 5 years old and prior, our brain is far more likely to go into imagery and colors and shapes and anything like a metaphor, rather than an actual scripted, I can see it memory. The reason for that is because our language skills weren't developed, so we call those a pre-verbal trauma. So it can be very confusing, like a dream, to make sense of why is this coming up. And in these cases, in all 3 versions, but especially with a metaphor, and especially with imagery that you don't know how to explain, you want to be able to, 1, go with it. That's a very common phrase in EMDR, is just trust yourself, go with it. Don't stop the process. Just assume that it's valuable. That's going to be rinsed and repeated a lot in the process of EMDR. But secondarily, these specific ones of metaphor coming up, it's going to be follow your body. Your body holds so much information while you're doing EMDR. because you could be amazed how you could say, nothing's coming up, it's a block. Well, what do you feel in your body? Well, I feel a tightness in my stomach, or it's in my chest. Good, go with that. And that just means focus your attention on that sensation, and your brain will usually make connections with, oh man, I felt that feeling during this time and this time and this time. So the more you just trust the combination of your body and your brain to flow to whatever seems important, you are going to make progress. Your brain is going to lead you to the very things that are going to lead to the reprocessing part through either eye movement, the sound, or bilateral stimulation in any way. There's one last thing that I need to mention that does come up a lot in EMDR therapy when it comes to the experience and how it feels, which is blocks. It means that you either come up against what feels like a barrier or, honestly, nothingness. Another common version of this is distraction, your brain going a mile a minute. This is insanely important information. This is not a failure in EMDR. This is information. Any kind of lack of progress means something. So I hope that if you experience that in your EMDR sessions, you do not get discouraged. Your brain, when it hits a wall or when it doesn't know where to go, or it's a mile a minute, like I call it moth mode, where you're just mothing all over the place and your thoughts are going to whatever you need to do, don't get discouraged. It's by design. So instead, the therapist will lean into that and you can sit with those barriers, because there is usually a fear. There is a part of us that feels like it's useless to go back into those experiences. And we need to respect and honor the barriers within us, because if we try to force our way past those, it is amazing how much our nervous system will actually block access harder next time. We need to be willing to accept and embrace resistance and hesitancy that we notice within ourselves. That is just as important as reprocessing the memory itself, is processing the defenses within ourselves and respecting them, because they've helped us to get where we are. So the blocks, resistances, and distractions, absolutely essential to the experience of EMDR, and it will come and go. You may have a session where you make a ton of progress and another one where you're very frustrated or feel like something's going wrong, that it's not progressing. That is normal. And it's important to sit with and embrace the resistance rather than feeling like it's in the way. It is the way. If resistance is coming up, that's what you go with to learn about. That's what EMDR is all about. Go with it. Now for an insanely important question, how do we know that it's working? So I'm going to talk about this from a therapist point of view first, and then I'm going to talk about it. How do we know as the client or the person going through it, how do we know what works in our own lives and our experience? So first, as a therapist, we know that EMDR works when we're looking for one major thing is what we take pretty much every session is a SUDS. A SUDS is a subjective unit of distress. Taking a SUDS allows us to track progress. Ideally, we should see a downward direction of the unit of distress. So a SUDS is basically looking for how distressed do you feel when you think about that memory. It can be anywhere from a 0, which is neutral, 10 to as strong as you can imagine. And if it's a memory that has that sharp spike, you might get close to a 10, but most often when you're dealing with a trauma, especially childhood trauma, it's going to be a present discomfort, but probably no more than, a 3 to a 6. If it gets higher, that means 1, you've hit a fantastic memory if it goes higher than that. But 2, we're going to be tracking a SUDS of like, okay, how would you rate that 0 to 10 in your body and in your experience right now? Over time, you will notice that as you revisit it and process it with the EMDR tactics, your SUD will go down to ideally 0 or 1. Now, there is plenty of cases where having some distress for a memory is going to be appropriate forevermore. But the idea is to get it into a tolerable distress or as low as humanly possible. Other than the SUD, which is taken throughout the multiple sessions that you'll have in EMDR, the therapist is going to be tracking how many positive, neutral, or negative occurrences happening. It's one of the markers that the therapist will have as they're progressing. So let's say you go through a set, a minute to a minute and a half, or 36 sets of bilateral stimulation. Check in. What came up for you? What did you notice? Therapist starts taking notes. What they're looking for is how much was negative or positive, and ideally, you can move forward to other phases of EMDR or show progress when there is either a neutral processing which is, oh, I'm noticing this aspect, as opposed to negative, which is, it's just horrible. I can't believe that happened. I hate experiencing this. That's such an awkward, it's so cringy. Or I feel sick and I feel panicky. That's the negative. That means keep processing. It needs more desensitization. Or if there's a positive one, such as, I never thought about what the other person was probably going through at that time. Now that I'm an adult, they probably were doing this. You have empathy for more people in the experience than you could when you first experienced it. Things like that are positive in terms of the direction. Now, once there are two positives, neutrals, or a combination of those in a row, like two sets, we then check back in and say, all right, I want you to go back to the original memory that we started with. And how do you feel towards that memory now? So we're constantly going back to the original target. It's very structured. The idea is not to let your brain go to an infinite train ride wherever it's going to go. We want to revisit and say, okay, let's recheck in. How are we doing about the trauma that we started with? So other traumas may come up, and a good therapist will take note of other traumas or other themes and say, hey, that's in a different theme. We are going to focus on that, but later let's go back to this one and make sure we're thorough with this one. So as a client, how do we know what's working for us personally? What does it feel like when it's working? So first and foremost, when you're in session, you will know what's working when you enter a mindset and a state where you trust the therapist and you trust yourself. When you become less worried about analyzing what comes up and you just go with it, which means if I have a whole set where nothing comes up, I just tell the therapist and I trust the therapist, I'm really getting nothing. And you let the therapist guide. You could say, man, I feel this tightness here, but I don't know what it means. You just kind of trust it and just let the process continue to flow. That is one sign of victory in EMDR, is that you find yourself just allowing yourself to go with whatever comes up, no matter how strange or no matter how frustrating it might be. The main sign that people are hoping for, and this is the one I would say is the most important in my life, was when I found more space between the triggering events and my nervous system reaction, or I noticed less nervous system, so I could advocate for myself in a more healthy way. So my biggest triggers were on people pleasing. Most of it came from my wife. My wife would either criticize me or say something that, or it would worry that I was disappointing her, or I would have this general anxiety when she walked in the room even. A lot of it stemming from my childhood. So as I started working on it, one of the victories for me was noticing, one, that I could notice my own anxiety. And I know that sounds like a weird victory, but when I could start to associate, oh wow, that stuff I've been working on in EMDR, it's happening right now. That is so healthy, because that means I've pulled myself out of autopilot just enough. And when you are not just autopiloting, you have chances to make differences. And that's where, and again, I may have done a lot of what I normally did when I was triggered at first, but noticing it was so huge when I could say, oh, wow, I'm doing that thing. Now, once I got the noticing down, there became a gap between doing what I always do, and there was more time where I could delay and say, oh man, no, I want to do something different. And then eventually, the more time and the more confidence would build up, where I found myself saying things and doing things and advocating for myself in ways that I felt were impossible before. And then it becomes an avalanche of, once I start doing it, it becomes easier and easier. So the desensitization doesn't stop in the EMDR sessions. It continues when your actions and the trigger points continue to happen outside of session, but you feel differently about them than you used to, because you've been desensitizing yourself to those trigger points in session. And it does. You start to feel it. You start to feel the same trigger points outside of the session, and it starts to feel less scary or less threatening. So that is how you know that you're starting to have some victories in EMDR as a client. Less emotional reaction. You find yourself being able to step up in ways you couldn't before, and overall less of the symptom that you came in describing: depression, anxiety, fear, whatever it was. All right, now I'm going to go through a basic common questions, the frequently asked questions for EMDR from clients that I get. I'm going to rapid fire through them as quickly as I can. Question number one that comes up the most often: what if I don't feel anything? A little bit, I talked about this before. A lot of times you won't. That is valuable information. As a lot of EMDR therapists will say, Just go with it. Question number 2. Why do I feel worse afterwards? Well, that's because you're making progress. Most of the time, our current coping skills will numb out or block the feeling of a trauma. So EMDR does bring some of that up, and it breaks down. I'm not going to numb this out. I'm going to choose to be curious about it instead. So yeah, a lot of times you're going to feel what you're supposed to feel, which sometimes is awful. Now, hopefully the coping skills that you learned and the resources you prepped with get you through those moments so that you can get back into session quickly and keep processing so that that worse feeling afterwards starts to actually completely change into either neutral or even a positive sensation about the same trigger points. So worse afterwards is kind of common. The extreme of opening Pandora's box is not as common as people fear it is. Third question, how long does it take? This is one of my favorite questions. If it is a singular event like a car accident, or you were involved in a shooting, or there was even grieving to some degree, depending on the loss, you can get through EMDR in anywhere between 8 to 12 sessions. I would say count for 12, but I have seen people go through an entire target of trauma in 3 weeks, 3 sessions. And I've seen other people that should have been simple tapped into something more complicated, ended up going 16 to 24 weeks. There's so much variation, it is unbelievable. But I would say on average, it falls somewhere between 8 and 12 weeks for a single target if you're doing EMDR every week. Next question, can it make things worse? 2 ways that it can. One, if the therapist that you're seeing is either not fully trained or if they have what's called therapist drift and they're not doing it according to the technical methods of EMDR, which happens a lot. People go deviating from the actual script. I don't recommend it. EMDR is structured and it works and it's researched. The second way the EMDR can make things worse is if you stop going. It's so important that you continue to do the work and you get through the hump, so to speak, of the difficulty and eventually get down to the other side. It does happen. Please let EMDR do its process because you can leave yourself in a rough spot if you decide it's making it worse and then you stop going through it. And the last question that comes up super often is, do I have to relive everything I've been through? Nope. You will touch on it in your brain enough to where it activates those neurons. From that point on, no. EMDR will take you through bilateral stimulation. Your brain may touch on it, but for the most part, your brain is insanely adaptable at going where it needs to go. So I will say this, trust that your brain is going to go only so far as you can handle. I've never experienced it where a brain took someone to a place that they could not handle. If they're willing to sit and explore it and be there with the therapist, they can get through it. And it's amazing. Trust the process. Go through the bilateral stimulation. No, you do not have to relive everything to feel relief. Now, for trauma therapy, EMDR is not the only one. There is internal family systems. There's trauma-focused CBT. There's lots of different trauma modes out there. So it's important that you know the general idea of what trauma therapy is doing. One, you have to have safety. There needs to be nervous system safety with the person you're looking for. Once you have safety, you then need to re-expose yourself to a little bit of the trauma. Most of the time, that is talking about it a little. I went through that. That happened. That made me cringe. You open up a little bit in the safety of the environment. Because most of the time, processing it in safety is what we needed back then that we didn't get. The next thing that's common to all trauma modalities is that processing part. Now, some it's doing a lot of talk therapy. My favorite are the ones that are more self-reflective. Both IFS and EMDR are incredibly self-paced and self-brought. Now, IFS is a little more directed by the therapist, but all of the work is being done by your own internal observations. EMDR, very much internal observation based. The reason I like those two is not only because they're structured and they are in that context of safety. The work that you do can get where it needs to go faster because a therapist has to do a lot of guesswork and assume things about patterns to try to push you in the direction towards believing differently about the world or about yourself. But man, if you build that skill set of being self-curious, trust me, your brain can get there faster than any therapist can. So I respect the work that the guys do within themselves, and I don't believe that I can get them there any faster than they can get themselves. So the processing part is really important, where try to find one that goes beyond talk therapy and goes to extreme self-reflection. And the last thing is the integrating what you've learned into your life. There needs to be, does this work in your day-to-day? And if there are barriers to that, or if it doesn't work, then come back and let's process what happened in that moment that is still triggering up your nervous system, and use EMDR or IFS to process that. So the integration obviously is where the rubber meets the road, so to speak. It's not just about talking about it, is did this make a difference for me? So most trauma therapies are going to have that progression. Safety is provided. You're re-exposing yourself to the experience somehow by talking about it or by remembering it, reliving it. Then you reprocess it somehow through whatever the method was, and then you reintegrate it into the rest of your life to make sure your nervous system adapted. Some quick indicators that it's not working for you, no matter what trauma method you're doing, is that you stay in your head the whole time. If you're just cerebral and analyzing and trying to put patterns together yourself and you're not in your body, that's probably a good indicator you're not going to feel the shift you're looking for. The other indicator is there's no shifts over time. When you look back over 6 months and you can't tell a single difference in your life at all, and other people can't describe a difference at all, you may want to mess up things a little bit. Either try different EMDR style approaches. There are changes they can make in EMDR, or try a different modality like IFS or trauma-focused CBT. Another indicator that it's not working is if things feel rushed or forced. And if it feels like either the therapist or you yourself are trying to jump to these conclusions because you feel like you know the right thing to say, but you don't feel the difference. So this is something that can't be forced. It needs to come naturally, and it needs to have that sensation of relief. If you leave every session and you don't feel at least somewhat grounded or at least equipped with tools, that is a dangerous place to be. So make sure that either you're asking your therapist or that you yourself are taking breaks, or even have a talk therapy session in between. Sometimes can break up that intensity. And the last sign that comes up a lot that it's not working is if you never actually get to the EMDR. Now, this happens a lot, and I do it sometimes too, where something in life happens and you end up talking 30, 40 minutes with the therapist about what's going on, and you never get to EMDR. That is going to mess up the flow. So there does need to be somewhat of a boundary keeping with the therapist in staying on point and saying, hey, unless it's an emergency, we got to go right into EMDR because we got to stay on task with this target. That is essential. If you find yourself looking for some trauma therapy or you're interested in trying it, if you live in the state of Texas, reach out. We have the Couch Psychology Center. We have a whole team of people that are EMDR and trauma focused with lots of different methods and modalities. Check us out and we'll find a therapist that fits for exactly what you're looking for. If you're outside of the state of Texas, you can still reach out. We'll be happy to support you and help you find either an EMDR certified therapist or an IFS, just any trauma model that fits what you're looking for. We want to support you. You can also check out our men's mental health brand, Zen for Men, which is at zenformen.coach, for more products, updates, and tools for you to use in overall men's mental health. I hope this enlightened EMDR for you and put it at a very approachable level. So no matter where you're at, please subscribe to this content. You can get more updates on men's mental health, infidelity, identity issues, whatever you're going through or someone you know or love is going through. Subscribe, leave a comment, let us know how you engaged with us, and look forward to seeing you in the next video. Take care.